So with that, our next group is from Coast to Forest, building a community strengths to promote mental health and reduce opioid abuse in rural Oregon project.
I literally saved thousands of dollars.
And thank you for being
Some
here.
of the prescriptions I need, they're just not good about. I have one prescription.
And if you see, flashes going off and cameras clicking and all that kind of stuff, it's probably your person who's getting ready to retire. So I think he wants to make sure he gets enough pictures.
Yeah, what are all the photographers?
Yeah, I know. We should have him up here, but I see him standing around in the back, and I worry that he might sneak up, start taking pictures, and you might get shocked. So I just wanted to let you know.
Good morning, Chair Roblan and committee members. My name is Javier Nieto. I'm the Dean of the College of Public Health and Human Sciences at Oregon State University. I'm here with...
Oh, that's right. We do have a beaver there. For the record, that's right.
I'm here with Angelee Calder, a student of the College of Agricultural Sciences, and Allison Myers, the director of the OSU Center for Health Innovation, that will speak to you in a few minutes. I originally trained as a physician in Spain, my country of origin, but I've been working in public health for 35 years, and I have the honor to serve as dean of the college here at OSU for the last 3 years. Our college is unique in that, for several reasons. One of them is that it combines, unlike many other colleges or schools of public health in the nation, combines the traditional public health disciplines with the human sciences, including human development and family sciences, which are very pertinent for the work we are talking about today. With a focus on prevention efforts and prevention of disease and the promotion of health and well-being to fulfill our vision of lifelong health and well-being for every person, every family, and every community in Oregon and beyond. And another reason why we are unique, and again, very pertinent to the discussion today, is our built-in extension programs within the college, our family and community health, and our 4-H programs that are present in all 36 counties in the states. These resources are critical to fulfill our mission of service to the people, in keeping with our role as a state public land-grant university, a mission that we are firmly committed to. During the last year, we have been talking to some of you about some of our plans to leverage our extension resources, our presence in all 36 counties, our connections with those communities that have been built over the last 100 years of our presence there. By adding additional capacity and expertise in community engagement, hire people in the community, people from the community, train them in community engagement, will become community health workers charged with bringing together stakeholders from the community, leaders, healthcare, public health, businesses, schools, etc., to initiate or to foster already existing conversations to identify if there's a problem, define it, and come up with locally based solutions that respect the uniqueness of each community. Today we are here to tell you about some work that we are doing with a focus on prevention to try to be part of the solution for the mental health crisis that is devastating communities and families across our state and our nation, complementary to the work on recovery and treatment efforts that have been presented in the earlier conversations today. I'm going to pass the microphone to Dr. Allison Myers, Director of the Center for Health Innovation at OSU. Allison is a connector. Her job is full-time to be a connector between our college and our university and the communities we serve and other stakeholders across the state who wish to partner as we fulfill our mission. Dr. Myers came to us in 2018, barely a little over a year ago, from University of North Carolina, right after finishing a health policy fellowship sponsored by the Robert Wood Johnson Foundation and the National Academy of Medicine. She worked with U.S. Senator Sheldon Whitehouse of Rhode Island, member of Finance Committee, and also with the staff of Senator Rob Portman of Ohio, to develop the bipartisan bill known as the CARA 2.0, the Comprehensive Addiction and Recovery Act, that became law in 2018 and authorized the appropriation of $800 million to go towards multi-level, multi-sector programs to stem the tide of addiction and despair. She's going to present to you today From Coast to Forest, a program that we are launching as we speak right now with funding from the National Institute of Food and Agriculture, the USDA funding agency. This is a pilot program in 4 communities, 2 in the coast, 2 in Eastern Oregon, leveraging our extension resources and partnering with local community organizations and CCOs. Again, using not a deficit approach, but rather focusing on the unique idiosyncrasy of each community and its strengths, its existing assets, to promote mental health, to promote mental health and reduce opioid abuse in rural Oregon. We are very excited about this program and how it could serve as a model for future work across the state to strengthen prevention efforts. Allison?
Thank you. Good morning. For the record, I'm Dr. Allison Myers. I lead the Center for Health Innovation at Oregon State University. I'm also the co-director of the Coast to Forest Initiative. I do want to make sure I acknowledge Marian Sarasso, co-project director, extension faculty Dusty Linnell and Robin Maley, evaluator Sandy Phibbs. There's a whole host of folks who've put this project together. I am the messenger in a lot of ways. At the risk of repeating, I do want to level set why we're here today, and I also really appreciate this particular work done by Trust for America's Health and Wellbeing Trust. In 2017, they put together what's called Pain in the Nation. It's a report. There's an update in 2009. But what they're doing, they're using Centers for Disease Control data to really amplify the national conversation about what they call deaths of despair. So deaths due to alcohol, drugs, and suicide together. And what I want you to see in the graph on slide 1 is 2 things. First, in Oregon, our despair death rates per 100,000 people are higher than the national average. That red line is Oregon at the top. And second, they're rising and projected to continue to rise. So you see the right side of the graph. We've got an uptick in that slope there. Maybe not the best possible data, but certainly the best available data to tell us the state of the situation. As a college, we've been committed to working in this space, offering health promotion, disease prevention efforts across the state. And we submitted a competitive grant proposal in June of 2009 to the Rural Health and Safety Education Program at the federal level and received a notice of award in August to do a 4-county 2-year pilot. In accordance with the call for proposals, the Coast to Forest Initiative has 2 primary aims. 1, to reduce opioid misuse and abuse and associated consequences, and 2, to improve mental health and well-being broadly defined. The project will be led by county extension faculty and educational program assistants in Extension HR. They're also community health workers and trained mental health first aid trainers. And then 2 or 3 of us on campus are worker bees, drafting materials and taking care of budgets and administrative tasks. Notably, we're not offering treatment. Rather, as Dean Nieto mentioned, the project is crafted to build on existing community strengths, to add fuel, to build bridges, to plus up what's working, and to move upstream to turn off the spigot of despair in directions that have already been identified as necessary by community residents.
Senator Bird has a quick question before you go.
Yeah.
Thank you, Mr. Chair. So related to the opioid issue, so down in Roseburg, where my home base is, we have the VA hospital, and especially in prior years, or previous years, I should say, we had quite the epidemic coming from that source of those opioids. And I was involved with a constituent several months back that she's a veteran. She has chronic pain, had to use a lot of opioids to avoid that pain. They recently put her on a pain pump, I believe is what they call it. And if I'm not mistaken, I believe they've reduced her use of opioids by down to 5% of what she was previously taking, with complete 100% success of relieving her of her pain. Are you guys familiar with what those pumps are? And if you are, what role do you see them as far as reducing people's use of them, as well as people that have gotten themselves onto it that didn't need it and getting them off of it?
Yeah, Senator Hurd, that's a great question. We do have a physician at the panel, but quite frankly, I don't know anything about pain pumps, and would say again that everything we're working on is upstream prevention, and that we'd have to defer to our medical provider partners on all of that. Yeah.
I would agree. I mean, I'm not particularly familiar with that modality of treatment. Sounds like a way to limit the dosage to a level that is tolerable and not excessive. So, but as Allison, I would say I would defer to my physician colleagues working on the treatment aspect.
Quick follow-up.
Sure.
Yeah, it's through the spine, as I understand it, is how it is injected. But yes, I would encourage you to research it and understand it, because I mean, to me, it's pretty groundbreaking, amazing. The VA is, I don't know if the VA is the first to start using it, but the VA is definitely using it.
Yeah, Senator Hurd, certainly as part of a comprehensive strategy, right? It's absolutely something that we need to know more about. Thank you. If my grandmother were here, she'd say I'm not that kind of doctor.
Yeah.
The four-county Coast to Forest project area, I want you to see here on the map. We're in Lincoln and Tillamook counties on the coast, and in Baker and Union counties in the east. This particular funding mechanism, the one that we applied for, the way we were able to get these funds, was very specific that it needed to go to rural counties with a RUC classification of 5 or higher. That's the Rural Urban Continuum Code classification, and with high rates of opioid abuse and overdose. So we started with Tillamook, Lincoln, Union, and Baker, but certainly hope to scale when we know that this project is working. All 4 of the project counties do have underlying characteristics that likely contribute to the opioid crisis they're facing. For example, Business Oregon has classified all of them as economically distressed. They also have a higher than average number of jobs in industries like healthcare, agriculture, forestry, and fishing, jobs that can be physically demanding, can lead to pain, and perhaps the use of opioids for pain management. And finally, in these particular counties, according to Oregon Health Authority and prescription drug monitoring program data, we do see risky prescribing practices. You have the logic model in a 2-pager in your meeting materials. Like good academics, there's a lot more detail, obviously. But I want you to see a snapshot of the program components. It's important for all of us to know that all of these programs have been blessed by the Federal Substance Abuse and Mental Health Services Administration, SAMHSA, in their recommended evidence-based approaches. So first, we're offering mental health first aid trainings in collaboration with the Association of Community Mental Health Programs that we just heard from. Quarterly in each region, you all may know of that training. It's a day-long training for any audience and teaches trainees to be first responders for people who are in mental distress, keeping them safe until they're able to be referred for appropriate treatment. Second, we'll be developing and distributing locally tailored resource guides so people in each place will know where to turn for help for that treatment. Senator Gelser, I heard you when you made mention of a particular resource guide just a few minutes ago. And in our meetings, we find that a lot of folks have sort of cobbled together things, and we look forward to trying to really make folks aware of where we can turn for help as we also improve access. Third program component, and this is a biggie, will be facilitating what SAMHSA dubs community conversations about mental health. That's a guided process to build local capacity and plan for community solutions. Fourth, we'll produce and curate local radio content, for example, personal stories of resilience and recovery, and expert interviews to destigmatize mental illness and offer hope. And fifth, we'll be coordinating Prevention Week activities, again, a SAMHSA national event, the second or third week in May, to raise community awareness about mental health problems and solutions. I've mentioned already that each of these program components are blessed by national leadership and have been effective in the real world. Given past evidence, we expect and will certainly be measuring progress towards the following outcomes from our program components. There are a lot of words on this slide, but I do want you to notice we expect more knowledge, awareness, and understanding about the issues and solutions among the general public, constituents. We also expect less stigma around mental health. We expect more skills, confidence, and helping behaviors to solve the problem. And particularly at the bottom of the slide, we expect that the communities where we're working will have plans and feel like they can execute them to promote mental health and prevent substance abuse in addition to offering treatment. One of the pieces of feedback that we received about the grant proposal was that we had an impressive list of partners. I've put a list of organizations on the screen who wrote formal letters of support for the grant proposal. This is also just the beginning in terms of leveraging the power of family and community health extension to convene and organize folks in the local area who care about the problem and want to come together for solutions. I'll close with this. I'd like to invite all of you to follow our progress. We certainly welcome you or your staff at any mental health first aid training or prevention week activity, or as participants in radio segments or community conversations. If you have partners you'd like to suggest, we're ready to reach out. And as we evaluate the efforts and learn what's working well and offering a return in well-being outcomes, I'd welcome a chance to come back and give you an update and talk about how we can scale the project. We have one more speaker before we take questions. I'm honored to introduce Angelee Calder. You've been so helpful to me getting to know Baker City as a new Oregonian. Thank you for taking the time today. You're going to talk a little bit about the work and what it means to you.
All right. Hello. I'm Angelee Calder. I'm a first-generation low-income student at Oregon State University right now. I have transferred from Southwestern Oregon Community College out of Coos Bay, and I'm now going to graduate in June with a major in agricultural science and a minor in comparative international agriculture. And I'm extremely honored to be here and tell a part of my story to you guys. And so I wanted to note that I've lived in my life over in 8 different towns across Oregon, all small towns, including Baker City, Brookings, Gold Beach, Agnes, Coos Bay, Lakeside, Sweet Home, and now Corvallis. Corvallis is the biggest town I've lived in. And I'm extremely proud of how far I've come as I've been able to break out of my own personal cycle of poverty by obtaining a higher level of education. And I wanted and I'm here today thanks to student support services available to me at these college levels. I would like to note on TRIO is an especially important student support services, and then counseling and psychological services at Oregon State, as well as Human Services Resource Center at Oregon State, which do really important jobs meeting the basic needs of their students. And thanks to these programs, I've been able to understand my world better and navigate it better to better myself and my community around me. And as a rural Oregonian, me and my peers have been faced with many unique obstacles that are not normal to other people. And this is including seeing tweakers on the street, for lack of a better word, friends turning to hard drugs as early as 13, and friends dying by suicide and overdose. And this is a huge problem. And so I would like to have you for a minute consider, at what point do you think that you have lost your loved ones to a drug? Is it when they start to try them? Is it when they start to prioritize the drugs over you or your family or their friends? Or is it when they finally die of a drug overdose? And in my past, I'm ashamed to say that I found that it's easier to give up on your friends who struggle with drug addiction than it is to step inside their complex world that you don't understand yourself, they don't understand. And but when in reality, it is at these points in their lives that they need us the most. They need the love, they need the compassion, to show them that the world isn't bleak, it isn't hopeless, and there's more for them than their drug of choice. Which will eventually kill them. So there's a lot of complex feelings that you feel when a loved one dies from an overdose. You don't know how to feel. Is it an accident? Is it suicide? Is it a murder? You have the feelings of what could have I done? What should have I done? And what can I do now for my family member, my loved ones still fighting the battle of addiction? And that is why I feel so passionate about the work that this program is doing, because it brings light and shines light onto these forgotten people of these forgotten towns. It promotes community education, and it shows these people that they have options, they have value, and there is hope. And it helps to provide them support to help them navigate their complex world to better themselves as well as the community around them.
I just want to say thank you very much. As a person who's at Marshall High School for a long time and who promoted TRIO my entire career, because it got started right when I was getting out of high school, I agree. It's one of the best programs that we have out there to help connect people with aspirations that they didn't see they could possibly do before they got involved with it. So, and I appreciate the people at Southwestern that have worked on that program for a long time. So thank you for that, and thank you for sharing, because these are always the best testimony in these places. It is hearing from people, and having also been raised in all rural communities all my life, and having known those people, I agree. How do you figure out how to help? And when you try to help and they don't want it, it's really frustrating. And whether it's family or others, and I have family that have made really bad choices as well. So it really, we do need to hear from you. And I would tell you of Oregon State here that using extension is really impressive. I had not thought about that, but they have credibility in almost every community in Oregon, and they bring with them that, and then they can introduce some of these other things that's going to be helpful in our better understanding across the state. So I'm really pleased we had this presentation. I'm really pleased that you're doing that. And you have an amazing place in Lincoln County. I went and visited not long ago because it's connected to the college out there by the fairgrounds. It's a beautiful building and a beautiful place, and an opportunity, I think, to have a group of people who would not necessarily have listened had it not come through extension. So I can't tell you how impressed I am that you've come up with this program. So thank you for that. Were you going to finish, or do we have any other questions from a Beaver or anybody else? Okay. Anyway, no, we do appreciate it very much. Thank you very much. And have you met this guy back here with the bow tie? I just want to make sure that you knew who he was in case you haven't met him. So. And congratulations, graduating this year.
Yes.
Do you know where you're going next?
I'm not entirely sure, but I've applied for USDA, ODFW, and the BLM. So.
Okay, well, anything we can do to help, let us know.
Thank you.
Working on getting her into public health, though.
Okay.
As a former agriculture.
Right, there you go. It all starts with what you eat, right?
Yeah.